All right. Good afternoon, Southcoast. It's Mike Silva, New Bedford Guide, fall reporter. We are here with infectious disease specialist, Dr. De La Cruz. He's with Southcoast Health. There's a lot of what I call misinformation, bad information on social media. We want to bring the experts in so you get the information right from the, as they say, horse's mouth. So if you can, doctor, just introduce yourself. Tell me what your role is at Southcoast Health. Give people a little introduction.
Hi, and good afternoon. Thank you for having me. I'm Lacerda de la Cruz. I am an infectious disease specialist with Southcoast. I am also the chairman of infection prevention for the Southcoast system. So basically, I treat infections and I deal with policies to prevent infections in our hospitals.
Yeah, so we're now like 18 months into COVID now, since we got hit last spring in 2020. Tell people a little bit about, if you can share what we learned and what's the reasons why COVID spread so fast and so violently kind of into society.
Well, there's a few things. What we have learned is that the virus is one of the same family of the SARS-1 and the MERS virus. There are coronavirus that have appeared to have a similar origin. They are related to bats, and we're still not 100% sure of how the virus came from the bats to the animals to the people. But it's a novel virus, meaning that it's the first time we encounter it. And therefore, we didn't have immunity to it. So that's why, all of us were susceptible to it, with some extraordinary exceptions. And, if you dig and you look in the press and the videos, you'll see there's some people that appear to be non susceptible to this, but those are very few. So we were very all naive to this virus. This is the new exposure. It's a respiratory virus that can cause severe pneumonia and severe inflammation in different parts of the body, not only the lungs, but it causes a severe pneumonia that sometimes leads to death. Roughly in about 3 to 4% of the people, although we have to make the precision that the risk of death of somebody that is younger and doesn't have any medical conditions compared to somebody that is older or that has cancer or is getting medications to suppress their immune system for other reasons, Crohn's disease, colitis, arthritis, people that have lung, heart, kidney disease, they have a much higher mortality than that 3 to 4%. We know that is a virus that has the ability to mutate, and that's why we've seen those different variants. And for the most part, remains without an effective treatment. Treatments are usually directed towards allowing your body finally to deal with the virus, but they have more of an effect of shorten the duration. And in two of those medications, they lower your mortality risk, but there is not as effective as you would say a bacterial pneumonia, where antibiotics have a much higher efficacy towards this. So we have learned that it's a resilient virus and that it's not going to go away that easy.
Yeah, and if you're watching at home, and I brought the doctor on, there's a lot of bad information on social media. We want to get the right information out there. If you have a question, here's your chance to talk to one of the leading experts in New England. You have them right here, so ask a question, and I'll ask them there. So, COVID-19 reproduction numbers play a role in preventing the spread. What's the difference between what is that reproduction number, and what's the difference between that and like a cold and a flu?
it probably referring to that attack rate that the different viruses have. If you compare it to the flu, the initial virus, the first version, the wild type version, if somebody had the flu, you will think that we will expect two other people to be infected by it. With COVID, it was more like three people out of one. But with this new Delta variant, it's about 5 to 7 people. So as you can see, this is, especially this Delta variant, is more significantly more contagious than the flu is, and that is important for us to keep in mind. There also appears to be a more frequency of these super spreading events with COVID than you tend to see with the flu. We had our own at the beginning of the pandemic, where that tech company had the conference in Boston, but we just recently had one at Provincetown, where you saw a super spreading event where 700 something people ended up being infected very quickly. So highly transmissible, especially this new Delta variant.
Yeah, so I've looked into that event. So it's like it was close to like 800 people in Provincetown, 4th of July weekend. They had a high number of people with vaccines that got it. But then I looked into it, like only out of the 800 people that got infected, like 7 had to go to the hospital.
Correct.
To me, that says the vaccine works.
It does. It does. And what we have seen, though, with this new Delta variant is that before the Delta variant, the vaccine was really, really highly effective in preventing infection, both symptomatic and asymptomatic, like in the 90s for the Pfizer vaccine and Moderna, close to 80 for the J&J vaccine. So we lost some of that. So the vaccine, you could have breakthrough infections more commonly than with the previous variant, although to prevent hospital admissions, they continue to be very highly effective. 88, 90% for the mRNA vaccine. So to prevent hospital admission and death, even with the Delta variant, the vaccines are really highly effective still.
Yeah, that's the key. I really try to impress on people is you don't get a vaccine to become 100% resistant to everything, to the COVID, but you are getting it to give yourself a higher chance of not being hospitalized and a higher chance of surviving the virus.
Correct. Especially if you or your loved ones are in those higher risk categories. Your best fighting chance is to be vaccinated when you meet this virus. And, as the situation continues to evolve, I think we know that we have a date with the virus at some point. So we are going to be exposed. The question is, are you going to be vaccinated or not? And depending on that, what are going to be your survival chances or your chances of avoiding a big scare of being in the hospital with a breathing tube for a few weeks?
Yeah, you talked about the comorbidities. CDC has a nice list on their website. Last year, I noticed that when it first, it went through China and Italy got really, really hammered. And what we learned early on was that some of these people had 2 to 3 comorbidities, obesity, diabetes, these things that already put you at, and elderly, older, right? So these are things. Can you just talk about some of the comorbidities that people need to be aware of?
Yes, age over 65, diseases that by themselves weaken your immune system, such as cancer, chemotherapy for cancer, medications that also are used to sort of weaken your immune system. As we spoke before briefly, people that have arthritis or some colitis, some skin conditions as well, and they use these medications to tamper their immune system a little bit, also will make you more likely to have a more severe infection with COVID-19. Obesity, and we have a lot of that in our country and around the world. But in our country, we have a a high number of high percentage of obesity in our population. Unfortunately, diabetes, chronic lung, heart, kidney disease, that also makes you prone to have worse outcomes and more severe infection with this.
Yeah, I don't think the obesity part is talked about enough. Obesity alone is something that puts you at higher risk, right? It's not that obesity because you have secondary problems from obesity, but obesity alone does put you at higher risk.
That's correct. And in many of the strategies that we use to prevent the virus, like with monoclonal antibodies, when we started with that, obese people by itself were into that high risk category without any comorbidities and continue to be. So you being obese by itself puts you in a much higher risk of dying from COVID-19 and having severe infection, landing in the hospital.
All right, so we talked about, things that put you at risk. What can individuals do out there to kind of reduce their risk?
There's a few things, and obviously the more clear one, and the one that has now um, almost a year after being approved and has continuously the numbers being updated and tested and looked at, is vaccination. If you get vaccinated, your chances of having the infection, having severe infection, landing in the hospital, or dying from COVID-19 greatly diminish. There's other things you can do. Obviously, masking. We know that works. Avoiding indoor crowds, that works. The longer you are in indoor space, especially places with poor ventilation, with a group of people, your chances of getting infection increase significantly. Um, in an ideal world, you would like people not to be obese, not to have diabetes and heart problems and all that, but that is unavoidable now. So the real effective things that you can do is get vaccinated, keep a healthy distance from indoor crowds, especially, and wear a mask.
So I'll ask you something that I see very common on social media. We'll take some questions, but I see a very common why people don't take it. This thing was approved too fast. I tell people is the science behind it is not new, but even though this virus is new, but so if you can alleviate some fears of people who say, hey, this vaccine has just been approved too quick, it's like testing the entire population, right? That's what I hear out there.
There's a few things that make this an amazing feat, right? So that, as you said, the technology is not new. The mRNA vaccines, the one that we have first, there has been work for decades now with mRNA vaccine for things like trying to prevent cancer, to attack cancer. That was the initial use of the platform, and then by the time this pandemic hit, there was already a vast experience from some scientific groups with these platforms. The other thing that helped this vaccine greatly was that we already knew two other viruses of the same family. So we didn't have to look for a target for the vaccine. We already knew how the virus will enter your cell and then damage your cell. So we knew that spike protein was the target. So that may, save months or years of work, because we already knew this family of viruses, although we didn't know this one specifically. And then there was and it has to be commended, there was a public-private effort, combination. Um, the governments put a lot of money and resources, and also reassure these companies that, you make a vaccine, you will buy it. So basically assure them that the supply was gonna be buy, and they also put money into development. So all of these things combined made for a very quick development of the vaccine. The other thing that is important is that there was no cutting corners when they were testing the vaccine. The same process that we use to approve every other vaccine that has ever been approved was followed with this vaccine. And I mean, Initially in the lab, it was tested to see if the vaccine will elicit antibodies. Then they test in the lab that those antibodies will block the virus. They can do that. They can culture cells and do that. Then they try it in animals and see if that worked. Then they try it in a group of people, small group of people, and see that it was safe and what are the dose that you need and that it was blocking the virus. And then you had a second phase 2 with a couple of 100 people, and then you had the phase 3 with over 50,000, 60,000 patients trial. And then from there, you got the final information that you needed, that it decreases the cases, it is effective, and it was safe. And then, as you know, you have heard before, probably most of the real bad side effects of vaccines you see within the first 2 months. So after that period was collected, the data was collected, then was the vaccine finally approved for emergency use authorization.
Yeah, I tell people is, if you remember John F. Kennedy, he had a mission to the moon. It took a while, but we've never had anything that we had, not just America, but all the countries on the world pulling resources behind it. Like, I know, like, part of it, I remember, I think it was Pfizer had like a, part of the problem was limited resources. So the government said, here you go, here's all the resources you need. And have you ever seen a bigger group of volunteers willing to be in a study like this?
Fantastic. It's fantastic. People here in Europe where the AstraZeneca vaccine was being developed, people just unselfishly, they just jump into this and were willing to risk their own health to get these vaccines, these answers for everybody else. But that was an amazing feed from, you know, clinicians and scientists and volunteers and governments, and that was fantastic. That's commendable effort. And as you said, you know, in the early 90s, in many places you didn't have a cell phone. The cell phones were this big. Remember that? The huge cell phones. And in a matter of few decades, you have a computer in your hands. So technology has been advancing not only in those areas that we see every day, but also in medicine.
Yeah, now you have a couple of 100 million people to pull data from.
You have more than that.
Billion, right?
Yeah, you have like 300 or 400 million doses already administered.
Yep.
And so you have ample, a huge sample to look for things that would be concerning. And for the most part, we have not seen that.
Yeah, so a few people, I can see questions in there, and I've read some things, and a lot of people who are against the vaccine will point out to these, what I say, outliers, very obscure. Someone, like, I read somewhere, I think it was in Europe, where a woman took the vaccine and she got a brain hemorrhage, right? But those are rare; they're not very common.
That's correct. We've seen some issues with clots and in the lungs, in the brain, with especially the Johnson & Johnson vaccine and the AstraZeneca vaccine. But for the Johnson & Johnson, which is the one that we have available in the US, you're talking about probably 1 in 700,000, 1 in a million. So nobody's saying that the risk is not there. It's there. But if you compare the risk of that to getting severely ill from a virus that we know is out there, and you are likely to get exposed to it, then you can balance that, and the balance is positive still for the vaccine. But that's one vaccine. We have 3 available. We have the Moderna, we have the Pfizer vaccine, which don't have that issue with brain bleeds or blood clots and that kind of things. But even though, as we just mentioned, the Johnson & Johnson still extremely safe.
Yeah, I tell people, you know, we get dozens of, I was in the military, I got more than most. We get all these vaccines throughout our life. I got the anthrax, I had to go to the Middle East. I don't know of a single vaccine that is riskless. There's always a risk with any vaccine you take, depending on your gen. I don't know all the details like you would know, but now you have to weigh the risk against the preventiveness that you're going to get. Like something like COVID is extremely dangerous. When I got the anthrax vaccine, the risk of me going to the Middle East, because I learned, I didn't know this, that farmers have been getting anthrax vaccines for decades.
Correct.
Because they deal with anthrax on the farm. And as I read, I realized, okay, it's not riskless, but it's something you have to deal with. So there's always a risk with any vaccine you take, but you're talking 1 in a million, 1 in 100, like several 100,000
Right.
changes. Yeah.
Right.
So I'm going to take some of these questions here. So Chris asked, I don't know if you know specific data on this, how high is the infection rate in New Bedford? What about the South Coast? How does like South Coast in some of the cities compare to, say, across other parts of the country as far as infection rate and vaccine rate?
Vaccine rate in the South Coast, we are about fully vaccinated people. We are in the 50s, 52%, as compared to other parts of the state where they're in the 70s. If you pull together all the data, it will come out as Massachusetts state will be in the 70s for people with 2 doses or more. But as a community in the South Coast, we haven't done as well, and we have pockets of our population that has not truly embraced the vaccine, or have concern, have not really moved towards getting those vaccinations. Compared to the rest of the country, Massachusetts is not one of the states that is doing the worst. We have seen an increase in cases, and I can tell you that at the beginning of the summer, June, July, in our hospitals at Southcoast, which is harder data than you can see if you look at any source. We are dealing with those patients in our hospitals, right? And you live here, you probably get your care here as well. So, June, July, we had maybe 5 or 7 patients in between the 3 hospitals, so very low number of cases. And now recently, over the last month and a half, we're back to having 40 or so patients within our 3 hospitals. So we have seen like a 7 to 8 time increase in hospital admissions since the beginning of the summer. So concerning for us.
What's the percentage of vaccinated versus unvaccinated?
The unvaccinated make most of the cases. We see like a 5 to 7 time more unvaccinated than vaccinated in our hospital. We are seeing some vaccinated people, but still, out of 40 patients that we have today, 5 are vaccinated. So 8 times more unvaccinated people in our hospitals.
Well, do the simple math. So you said half the population is vaccinated, but 7 times as many people have unvaccinated in the emergency room or hospital. That tells you 50% of the population is making up the vast majority of the people heading in. It's the unvaccinated population. Is that correct?
That's correct. It has become predominantly an infection that we see in the unvaccinated for the most part.
They have to go to the hospital because
yes,
if you got the vaccine, you have a chance of mitigating all your symptoms. You might not, you got it. So you become a carrier. And then why I heard Dr. Fauci say why the vaccinated should wear a mask is because you're preventing it from going to the unvaccinated potentially while you're out and about. Is that right?
Yeah, that's many people are a little bit of frustrated about that. Like, I took the vaccine, I'm fully vaccinated, and now you're asking me to wear a mask. Why is that? Why not the unvaccinated wear the mask? And you could make an argument of that, but the principle is that now with this Delta variant, we know there are more breakthrough infections. Even if you're vaccinated, you could still have a symptomatic or asymptomatic infection, or not asymptomatic, mildly symptomatic infection, and you can transmit it to somebody else. So if you're around somebody, let's say that is not able to be vaccinated because they have an allergy or something like that, or is a cancer patient that we know, and we recently saw an approval of a 3rd dose for them because the vaccine wasn't as effective for them, then you even though you're vaccinated, you could still transmit it to those persons. So that is the rationale behind it.
Yeah. So I want to talk a little bit about treatment. So the problem you see on social media is, and you see it all the time, is people, I even see now where people are taking horse medication, right? Instead of going to the hospital, and they're doing these over-the-counter horse medications. What are the proper treatments for COVID?
So the treatment that we have that are approved are monoclonal antibodies, which are antibodies against the COVID virus that are made in the lab. And if you are sick and you can get to a monoclonal antibody soon, especially within those first 4 or 5 days of you getting ill, those are highly effective in preventing you from going to the hospital or dying. We have an antiviral medication called remdesivir, and remdesivir, basically what it does is shortens your time being sick. It doesn't unfortunately prevent you from dying. Then we have medications called steroids, which are powerful anti-inflammatories like prednisone or dexamethasone that some people are familiar with. And those we use to target the inflammation that the virus triggers in your body. Your body is trying to defend against the virus, and it causes inflammation as a byproduct. And that sometimes is what kills you. That exaggerated immune response trying to control the virus, and those help with lowering your mortality risk by about 30%. And then we have a specific monoclonal antibody class that we can also use to control or try to lower down inflammation levels. And those also seem to have a modest improvement of mortality. Those are the classes that are approved by the FDA and that we are recommending in our hospitals in Massachusetts and throughout the country and the world. Ivermectin, which is that antiparasitic, has not been proven with precision, doesn't have a strong evidence that it is helpful and that it works. And you have seen lately that the FDA, the CDC, and all specialty societies have recommended against using that.
Yeah, I think it's crazy. People, they don't want to put a vaccine in their body, but they'll put some horse, drug in their body that's untested. I guess I want to go to that first thing you said about injecting antibodies. So it's kind of critical is once you get symptoms to go get tested, to get treatment early. And that's like people resist going to the hospital until they're like collapsed and by the time you're brought there, it might be too late. Get there early. Correct? Get treatment early. That's the key.
Yes. Even mild symptoms could be COVID, and especially if you are unvaccinated, if you are in those high risk categories, don't wait. Get tested so you know what you're dealing with, and you have those options available to you. And you can get those injections. They're now subcutaneously. You can get it through the skin before you have to get an IV and get an infusion. Now you get a shot in your arm, and those are highly effective if you get them early enough. If you don't wait until the second week or third week of you feeling sick, then that's too late.
Yeah, I want to really impress on people that, one, get the vaccine. If you're not going to get the vaccine, but you get sick, go to the hospital. And an important part of that is I'm trying not to speak too negative unvaccinated, but if you're overwhelming the hospital system, you're also putting some of the medical professionals at risk by overwhelming, giving a chance to infect them. Even though they've been vaccinated, they have a chance of getting the disease and being impacted by it. So get there early. If you got symptoms, go get tested. We're gonna I really appreciate your time. We've been it's almost a half hour now. I put a link in the description. Southcoast currently has 4 public clinics located across Southcoast with a variety of hours. Walk-ups and reservations are welcome. To find a convenient location, I have a link in there. It's southcoast.org/COVID-19-vaccination. If you want to go get your vaccine, you can get that. If you and one thing I want to press on people too is we bring on the experts on here, but call your doctor. Your doctor knows you best. if you have something that a vaccine might be not good for you, they'll let you know. They know your medical history. Dr. De La Cruz is not going to, he doesn't know you out there, but he's just giving you general information for the general public. Your doctor knows you best. Don't have to believe us. Call your doctor. They'll give you the right information. Is that the proper way to recommend?
Yes, if you still have doubts, if you have a special condition that you're not sure, call your primary care doctor, have a discussion with them. There are vaccines that might not be appropriate for you, or one that might be better suited for your specific needs. We have 3 different choices. So I think among those 3, we can, for the vast overwhelming majority of people, we can find one that you could take if you choose to do so. I think that it is important, I think, that we stop thinking about vaccines as a political stance or as a civil rights or liberty issue. And I think we should see these efforts to control this pandemic as a community effort. This is one of those things that we need to solve as a community. And throughout history, Americans have been very good at getting together in times of crisis and facing big challenges together as a country, and we have failed to do that. And as a community, as society, I think we should understand this problem as a community problem. We have to put the effort together to fix the problem.
Yeah, I'm going to do a few more questions and we'll close off. So BJ says, listen to him, listen to your doctor, listen to science. Don't listen to anyone without a degree in medical science. Common sense. They don't always don't know what they're talking about. Let's see here. So one person, Sandra, says, I have lupus, so I'm scared of the vaccine. Do you have any advice for her?
So people with lupus do not have a contraindication to get vaccinated. What could happen to you is that depending on the medications you're on, you might not produce a very strong response. Your antibody levels might not be so high as somebody that doesn't have any of those diseases. And you might be one of those people that need a 3rd dose. But if you have questions, as we have said, you can consult with your rheumatologist, with your primary care doctor, and I'm pretty sure that once they review your specific case, they will be able to guide you better. But there is no contraindication for people with lupus to get vaccinated. It's actually they actually might help somebody like you, especially if you are taking immunosuppressants, to do better if you get COVID-19.
And another question is, now this is an open-ended question about when do you think COVID will go away? Do you think this is going to be like a flu? I know I've heard 6 months boosters. I've heard, do we get another variant that becomes COVID-21? Do you think this is something we have to deal with for a long time?
Yes, unfortunately.
Yeah.
We might have had a chance before. I think we are going to be dealing with this on a regular basis, and WHO, CDC, NIH are all telling us that this is likely going to be an endemic virus we're going to have to deal with for the foreseeable future. So right now we're talking about that booster at 8 months. I don't know if it's going to be for the whole population or only for high risk groups, but we should expect, even if not at 8 months, that we're going to need a booster dose at some point.
So I think it sounds like you're saying that we had a chance to, if we got everyone vaccinated, maybe the variants wouldn't have came out, but these variants are just going to keep popping up.
Unfortunately. And there's going to be, as long as they're susceptible individuals, and there will be, I think we have to be cognizant that coronaviruses by itself do not produce long-lasting immunity. It's not like, you got measles, that's it. You got chickenpox, you're immune for life. That doesn't happen with human coronaviruses or other coronaviruses. So at some point, your immunity is going to wane, and we're going to be back in the cycle of people being susceptible and having infections. So I think we should all be ready to learn to live with the virus and try to do our best to protect ourselves.
Okay, there you have it. So I appreciate your time, Doctor. If you have questions, post them in there. We'll take a look at them later. But head over to the Southcoast website. You get more information. I always recommend head to the Department of Public Health for Massachusetts. Get great information over there. Of course, the CDC, great resource. But in this area, Southcoast Health is your authority, and we're going to keep bringing doctors on consistently to get the right information out there. So I really appreciate your time, Doctor, and hope you have a good day.
My pleasure. Thank you.
Anything you want to end with at all? I'm sorry.
I just to tell people that it's right that you question, that you ask questions, that you want to be informed. I hope that you're asking questions with the openness to listen to the answers and evaluate them objectively. There are, as you mentioned, many official good sources of information that you can read and educate yourself and listen to. And you should do that and not follow information from sources that are dubious. And as I said, this is a community effort. The community has to solve it. If we do not unite around this is something that we're going to fail at defeating and controlling.
All right. I appreciate your time, Doctor.
Thank you.